All right, hey guys, we're live. It's been a minute, but we're back. We're doing a live stream here on the Facebook page as well as the YouTube channel. So we'll see if anybody jumps on, see what questions you have today. I'm just loading up all my different streams to make sure everything's working. It says we're live. Are we live? Looks like it. People are watching on YouTube. Hey, YouTube, if you guys have questions, you can put them in the chat, and we'll be happy to answer them. Let me know if you can hear me and see me. See if this thing's working. When was the last live stream? Gosh, probably like May sometime. It's been crazy, but figured what the heck, let's get one going. It's been a while. All right. My title says cover 19, but I think you know what I was talking about there, COVID-19 typo. Hey, everybody on Facebook, people are jumping on. Welcome. Are we seeing people for yearly checkups? Yeah, good question. Kind of very individualized right now. You can get an appointment. The first thing I'd recommend is consider a virtual visit. We just started doing those last week. We're just getting that up and going. So you could call in and talk to the nurses or talk to the switchboard and see what's going on, and then we can decide together with you what's the most appropriate thing to do. If it's just a checkup, probably better to hang tight for a while. But if you need meds refilled and stuff, then give us a call and we're working that stuff out just kind of individually. All right, so if you're jumping on Facebook and you have questions, put them in the chat there. I'm watching those. I'm also live on YouTube. Hello. Hey there, we see people jumping on from Italy. That's crazy. Yana, hey, how's it going? Let's see, is there anything you can do to help fight HPV, third leap within 10 years? There have been people using the HPV vaccine up to age 46. So people who have abnormal PAPs, if you didn't get that Gardasil vaccine, it's still an option. So that's something to consider. Lexi said, should I wait until quarantine's over for my postpartum? Yeah, and if you need birth control, you can just call in, and if it's something we can get your prescription for, that's no problem. And we're doing virtual visits as well. I just started doing those. I think Shannon's done a few, and we'll get up to speed with that. So you can call in, and we can help you work through that. Let's see, Amanda, how do you think this new virus will affect pregnant women? Well, it's definitely a concern, Amanda. We're talking about COVID-19, of course, or coronavirus. The overall evidence from China, which is where the majority of the data is coming from at the moment, didn't appear that pregnant people were at any increased risk for complications over non-pregnant people. But obviously, anyone, even young and healthy, can get the infection and can become quite ill. And certainly that would present a problem for someone if they were pregnant as well. We know that in other respiratory situations like the flu, for example, pregnant people definitely are at increased risk for complications. So we think that it's still possible that with coronavirus, things could be worse as a pregnant person than not. We just don't have tons of data. So, all the information, all the recommendations about social distancing are still really important, especially for anybody who's pregnant. And we are looking at doing some of those prenatal visits virtually as well. So you may be hearing about some of that stuff. Thanks for the kind words there, Kim. Back at you. Let's see. If you have questions, put them in the chat. I see one on YouTube here. What could cause pelvic pain since a period started or ended? Ovarian cysts, certainly a possibility. Endometriosis sometimes are possibilities. It's one of those things that without a lot of detail, kind of hard to answer. But a good history and potentially physical exam or ultrasound in this time would be probably a good idea. Thanks for the stay safe there, Island Girl. How are things in Italy? I know in northern Italy it's been pretty scary. I forget what part of Italy you're in. Hopefully you're doing well up there. So hey guys, on Facebook, people are jumping on. If you have a question, you can put it in the chat. We're mostly talking about just whatever questions you have on your mind. Certainly, I'm sure a lot of people have questions about coronavirus. So happy to answer those and or whatever else you got going on. Let me know if I think both of my comments are working. I think I'm seeing everybody's comments popping up here. So let's see. Lexi had a question. Do you not have a period when you're breastfeeding? Typically, you won't. So, especially if you're nursing exclusively, so no supplementation, all the feedings are coming from the breast. It doesn't matter if it was pumped breast milk or just directly from the breast. In either case, that could suppress ovulation, and so typically you wouldn't have a period, which is why breastfeeding is pretty good birth control. But I always tell people, number one, it's not a guarantee. Number two, the minute you start to wean, it is no longer a good method of birth control. Let's see. Natalie got last depo in December of 18. Still no periods, not in menopause. Let's see what the rest of this says. 34. What else could this mean? Some, basic lab work, check your thyroid, check some other hormones would probably be a good idea. Pregnancy test, obviously. Would be the things to look at. I doubt it would still be left over from depo. That's been a couple of years ago. Well, at least a year and some change. So probably worth reviewing what labs were tested exactly, and then kind of going from there. Let's see. Joanna, do you have any updates on hospital restrictions getting induced on Friday? Yeah, so right now there's just one visitor is allowed that's throughout the entire hospital stay. So, typically that's dad or another support person. The one exception at McKay is if you have a licensed doula that is registered with Intermountain, they can be there for the labor and delivery experience as well as a support person. But assuming it's not a licensed doula that's registered at Intermountain, then it's just basically one visitor the whole time. I think they're banding the visitor at the beginning of the process, and that's the only person that can be allowed to be there. But otherwise, so far, so good. Kim said, can coronavirus be passed to your baby in utero? The short answer is it is possible. Although so far, to my knowledge, there have been no documented cases of it being passed in utero. Again, limited information, mostly coming out of China so far. We'll have more information in a few months here in the U.S. The Maternal Fetal Medicine Units Network is, following as many pregnant people who get infected as they can through a registry database. So more information from the U.S. will be forthcoming. But what we've got so far comes from China, and so far, hey, Michael's waving. So far, there's no evidence of transmission to a baby while mom was pregnant. Now, a mom who's positive could pass it on to a newborn, and that has been documented even within a day or two after birth. And there may have been, and before I totally answer that question, there may have been one case. There was a case reported like on Friday, and it's been written up in the Journal of the American Medical Association that showed there may have been transmission to one baby. More on that to come. But that's sorry, barking dogs. That's the only one we know of in the U.S. So slightly longer answer than maybe you're looking for there. But so far, pretty reassuring data. But the concern is going to be potentially postpartum. Lottie, I've missed the AMAs. Thanks for saying that. Missed them too. It's just been kind of crazy world these last few months. Let's see. Jump back on YouTube here. 20. We talked about that one. Pelvic pain we talked about. Lexi we talked about. So you're in Turin. Yeah, we were not too far from there in northern Italy a few years back. Yeah, it sounds like hopefully things are starting to turn the corner there in Lombardy. I hope that that's true, and I hope you guys are staying safe. Let's see. Amanda says, another question. I have to take the glucose test in 3 weeks. Is it super important? Yeah, that is okay. So let's just talk about that. Let's talk about what do we think we're going to do for prenatal care, at least for the next couple of months, and it may be a little bit longer. We'll have to see, of course. So the concept is that there are certain visits that need to be done in person, face to face. And that glucose test is a good example because it's kind of hard to draw your blood if you don't show up. So it's hard to do that one virtually. So that is one of the visits that we recommend as an in-office visit. Another one, of course, is the very first visit. Anywhere from 8 to 12 weeks is fine. 12 weeks is probably ideal. We're happy to see folks sooner, especially if you have a history of miscarriage or unsure period, stuff like that. But the very first kind of definitely mandatory, around 12 weeks for sure. We can date the pregnancy. We can do nuchal translucency screening if you want to screen for Downs. You can do blood work if you want to screen for Downs. So that one, 12 weeks for sure. 20 weeks is the next big one. That's your targeted ultrasound, detailed anatomy scan, checking out the baby. More barking. And then 28 is the next definite in-person visit. That's for glucose test, RhoGAM shot if you need it because you're Rh negative, and a Tdap shot. And then definitely 36 weeks is the next mandatory in-person visit. So you can do a strep test. Now mandatory, I'm saying highly recommended, right? So those are about 4 definite gotta do-ems, and then maybe at least one more there at the end, 38 or so weeks. And this is assuming a low-risk pregnancy with no complications, no concerns at all. So short answer to your question, 28 weeks, yep, we would really recommend do that glucose test, plus you need a Tdap shot anyway. So hopefully that answered your question, and hopefully that answers other people's questions who are wondering, like, how the heck are we going to do this? Some of the in-between visits, say like 16 weeks, 24 weeks, 32 weeks, we're going to offer people to do those virtually. And you may wonder about that, like what the heck's involved in that. Well, I think a big thing is just an opportunity to talk, answer your questions, see what's going on, determine if there's any things that need to be addressed in person, and assuming not, then we can just chat, answer questions, talk about routine stuff. Other good information to gather at those visits, if you have the ability, you could get a weight. We could enter that weight from your scale into the record so we can see how you're doing with your weight gain. If you have access to a blood pressure cuff, you could check a blood pressure. And then if you have access to a fetal Doppler, you could auscultate the baby's heart rate. Not necessary. Certainly if you're far enough along to feel fetal movement, that's also fine. For the moment, that would cover the bare necessities. And then we could determine, from there if more frequent visits are necessary. And again, that's assuming this is a low-risk pregnancy. So it kind of gives you an overview of what we're thinking for prenatal care, at least for the next 2-3 months. I hope it doesn't go longer than that, but that's at least for the foreseeable future. Denise, yes, the pups are feeling better, thanks. They still coughing a little bit, but a lot better, so thanks for helping with that. Question is, what's the plan for routine visits to refill birth control? You can call in and we will refill your birth control for the next 3 months. Basically, no questions asked. So you can just call in and we can take care of that for you. We'll regroup after things settle down. And that's, again, assuming everything's going okay, no problem, stuff like that. So feel free to call in for that. Let's see. I think I missed one here from Kara. Period's been all over the place last year after having 6th baby. Never had that problem before. What can you do about it? Checking your thyroid for sure is a good thing, so it's good that you checked that. Without seeing someone or at least talking to them, it's a little bit hard to give you an answer just based on the information in this little blurb here. But, in general, I would talk to a patient, see what their bleeding pattern has been like. How long has it been going on? You said for the last year. A simple thing, check and make sure that the person's up to date on their pap smear. Have they had a recent ultrasound? Probably. If you had a baby last year, then we took a look at your uterus and the fibroids, stuff like that. So assuming all those things are true in this short term, while we're in the middle of this coronavirus pandemic, I would recommend a virtual visit, which you can schedule through the office. We can talk about it. And if it seems appropriate, and if you're agreeable, then perhaps trying to manage that bleeding hormonally for the next little bit, maybe a birth control pill if that's appropriate, or something like that would be a reasonable next step until the dust settles, and then we could always have you in the office. Now, if it's an emergency, we're going to see people, but if it's things that we can handle through a virtual visit, for now, I think that's really preferable, just to try to keep everybody safe. I'm wondering if this looks... Tell me if on YouTube if it looks like it's in focus, because it looks blurry to me. I guess that's clear. Okay, so I think I'm all caught up on YouTube. If you guys, Facebook, have a question, stick it in the chat. I'm just going to scroll back and see if I missed anything. I don't think I did. So welcome if you're just jumping on, just answering your questions. We're on YouTube and we're on Facebook. So we've got people watching from northern Italy. I know for a fact, my good friend Island Girl. So let me know where you're watching from. I think a lot of you, certainly on the Facebook side, are probably watching from locally. And if you have questions, you can stick them in the chat. All right. So at the moment, no questions. I'm just going to take a break, take a swig of water, and see if anybody pops up. Sadie says, if we're wanting to tip our chances for a boy, do we schedule with you first or call and get a reference? There's nothing that we can do medically to help you get a boy at our office. You know, if you have a large family and you have a bunch of girls and you wanted to get a boy, there are some things you can do, none of which are natural or from home, but you can do in vitro with pre-implantation genetics. Costs you about 15 grand, and it works. And they will do it for family balancing. So if that's a concern, then that's an option. So let's see. So Kaylee says, so prenatal visits are not being canceled. No, we're not canceling prenatal visits, but we maybe, I don't know if you heard the whole spiel before. Let me know if you heard the whole spiel or not. I don't want to go back through it again for everybody that's been watching, but if you didn't hear it, let me know. But we are spacing them out. We are doing certain ones in person and probably will be doing certain ones virtually. You may be hearing from us from the office or maybe at your next visit with your provider to figure out what schedule is right for you. So let me know there, Kelly, if you heard that spiel or not. Let's see. Jordan says, why would my menstrual cycle certainly change being once every 2.5 months for the last couple cycles? Hard to speculate just based on short period of information and short period of time. But, you know, the simple things like, well, make sure you're not pregnant, check your thyroid, a few things like that. If they're getting heavy or weird, then sometimes we'll do, an ultrasound to evaluate the uterus. But it would probably be an appropriate first visit to do as a virtual visit, Jordan. We'll be taking those appointments tomorrow, Monday. I've got openings Monday, Tuesday. I was just looking at my schedule. Pretty much all week, there's a spots to put people in for a virtual visit where we could talk about it in some depth. So I would recommend considering that. Let's see, Anna, if you have minor concerns medically getting induced tomorrow, okay, just to wait. Probably okay, just to wait. If you have concerns beyond that, you can give us a call. Let's see. Okay, I said jumped on, just sorry. Okay. Yeah, Jordan, for you, I would suggest call and get a virtual visit. We can get that scheduled for you this week. Okay, Kaylee, real quick. And for anybody who didn't already hear this, and if you did, sorry to repeat it, what's the big picture on prenatal visits? The big picture is there's at least 4 visits that need to be done in person. And so those 4, there's really no way to get around it. It's your first visit, which could be 8 to 12 weeks, a targeted ultrasound around 20 weeks, a glucose test at 28 weeks, and a strep test at around 36 weeks. Those have all got to be done in person. And this is assuming a low risk pregnancy. In between those visits, so like 16 weeks, 24 weeks, 32 weeks, potentially those could be done virtually. So we have that capability now in the office to discuss with you virtually, basically like over FaceTime, but we're using WebEx to discuss those. So that's kind of the gist of it. We're not canceling them, but we are definitely massaging it. We are trying to not have as many in-person visits for any reason, of course. The state of Utah has put out a recommendation that you should not go out in public for anything other than basically vital things. Seeking prenatal care, of course, is very important, as are certain other healthcare concerns. But some of those things can be handled virtually. So just know that we're looking at that. Let's see. Okay, YouTube, there's some questions here. Let's see. Period's been consistently 6 weeks apart. Been trying for 5 months. History of infertility. Should we make an appointment? Yeah. Yeah, at 37 especially. You're 23. Oh, you're fine. Paternal age of 37 is not such a big deal. 23 makes it certainly less of an emergency. I thought it said you 37. Yeah, once this blows over, make an appointment. And you're welcome, if you're a patient of our practice, you're welcome to do a virtual visit, and we can talk about it. So that's something that's an option. Let's see. What would you do if you tried to Clomid 3 times and still have not gotten pregnant? First thing I would do, Delina, is there's a video on my YouTube channel, which is not linked on this Facebook page, but if you go to YouTube and just type in Wes D Ski, W-E-S, letter D, ski, like I like to go skiing, Wes D Ski, there's a video on there that talks about evaluation of infertility. So I would go check that out, and I would say all the things that are listed in that video are the things that I would do. Big picture checking, hey Angela, we're checking sperm, ovulation, and tubes, and so those would be the three things to be thinking about. It's possible you're not ovulating yet, even on the Clomid, so there's some ways to try to document that with ovulation predictor kits, and some other things, ultrasound maybe. So, but at any rate, I would think about that stuff. I would consider getting tubes and sperm checked if they haven't yet already. If you've been trying for, say, about a year and you haven't gotten pregnant. Let's see. Jessica says, if I'm high risk, will my visit stay as in office, not virtual? Say more likely that's the case. I still think, every patient, it'll be an individual discussion with their provider and the patient as to what's most appropriate. And anybody who just feels comfortable, or rather uncomfortable not coming in, that's still going to be an option. So we'll work it out. It's more or less on a case-by-case basis. But I was kind of given the big picture for a low-risk pregnancy. Okay, let's see. What's the big deal for paternal age? 47, too old? It's not too old. If father of the baby is 47, you still see plenty of folks getting pregnant from a guy who's 47. It's not until you get into the 50s that you start to see real issues with advanced paternal age. So probably in and of itself, otherwise healthy 47-year-old guy, probably not a big risk in terms of fertility or other concerns. Okay. I think I'm caught up. So if I missed your question, pop it back in there, copy and paste it. Let's see. Delete. We've had sperm checked. Was told you weren't ovulating. That's why I gave you Clomid. So what would checking the tubes consist of? So that's called a hysterosalpingogram, HSG. It's an X-ray, which probably right now would be difficult to get done because it's not, a pressing matter during the middle of a coronavirus pandemic. But once things settle down, it's an easy procedure to do at the hospital at the radiology department. Basically, they put you up on a table that's similar to like what you do for a pap smear, put a little catheter up in the cervix and shoot some contrast dye, and they take an X-ray. And then you can see the uterus fill, and you can watch the tubes spill. And there's some pictures of that on that YouTube video I was telling you about a minute ago, so you can check that out. But my understanding, I think at both hospitals now, definitely McKay, they're not doing outpatient imaging for anything that's not just an emergency. So probably things like HSGs will be on hold for the time being until things settle back down. Okay. I think I'm caught up. All right. Well, still see some people on both channels, YouTube and Facebook. So if you're watching and you have a question, feel free to put it in the chat, and I'll be happy to answer it. We'll see if anything else pops up in the next little bit. No one's asked in a minute, so I don't know if people are still on here that are new, that didn't hear it before. But, of course, one of the major questions is what's the deal with coronavirus and pregnancy? And the short answer is that the limited data we have from China is relatively reassuring, but by no means do I think we're off the hook. There has been one potential transmission from mom to baby in utero. That one's still being investigated here in the U.S., That just got reported, I think, on Friday. Very limited info on that one so far. Everything else, from China so far, they didn't document any transmission from mom to baby. But I think the data is still early, limited, and probably more to come. Definitely recommend to everybody to follow the social distancing recommendations, particularly state of Utah has put out, that are basically stay at home unless you really got to go out for an emergency, or because you have no choice but to go out because you have to work in a critical part of the workforce. Believe me, if I could stay home, I would. It's not an option. So, not seeing any other questions pop up. We'll give another minute or two, see if anybody else has questions to put on the chat. If so, feel free. Be happy to answer them. Otherwise, we've been going for about 30 minutes, so we might wrap it up unless we see some more questions pop up. Anybody still watching on YouTube? I can't tell. Hey, Penny, how's it going? I think there's still some people watching on YouTube. Let's see. Kelsey says, would your husband's seizure meds prevent us from having another baby? Topiramate, Lamictal. Probably not. Now, I'm not a male doctor, specialist type guy. But I don't think either one of those would be a problem. Topamax, if you were taking it, has been associated with higher risk for spinal cord defects in a baby. But not, as far as I know, not for a guy taking it. And Lamictal, I think, is fine in women anyway, so I wouldn't think that'd be a problem. So I don't think it's a problem for him. I don't think topiramate would have anything to do with like sperm production or anything. Let's see. Kaylee says, how long do you think it'll be before things are opening back up? I wish I knew. My best educated guess, and this was based on a conversation I had with my son while we were hiking the other day. He said, I'm okay with it. I just want to know when it's going to be over. I'm going to say July 4th. That's my expert opinion. Take that for what you will. But I'm hoping by then things have settled down dramatically. I was looking at some data from University of Washington, which is a pretty reliable virology lab. They were one of the first labs in the country to be testing for coronavirus. They predict Utah's peak at the end of April, so the worst day, the most deaths, the most hospital admissions, probably towards the end of April. And then another, month or two for it to go back down. So that's my guess. In some ways you hope that it's longer because that means that social distancing measures have been effective at slowing the rate of transmission, and therefore it takes longer to get to the peak, which is what you want. That's that whole flattening of the curve everybody's talking about. In an ideal world, we would not have everyone get sick at once and all go to the hospital all at once, because that will overwhelm the healthcare system. So slowing down the spread, preventing spread whenever you can, is what it's all about. So there you go. That's my best guess, July 4th. All right. Penny says, going well, enjoying your time with your child. That's great. I'm glad. Stay home, wash your hands, right? Okay. Well, Facebook, if you have other questions, stick them in the chat. Otherwise, we'll probably wrap this up here shortly. But it's been fun coming back, doing a live stream. Haven't done one in months. So I got all my computer stuff working, and looks like my phone's working. So I was happy that after not doing it for 6 months, I still remembered what to do. Well, not seeing any more questions popping up. We'll give it another minute or two. If you're on Facebook, if you're just jumping on and you have a question, put it in the chat real quick. Waiting for someone to ask a question so I can answer it. And if we don't see any more questions pop up in the next minute or two, we'll probably call it good. Hope everyone is staying safe out there, following the social distancing recommendations. They really are important. I've had 2 or 3 or 10 patients, maybe, I don't know, in the last week or two asking me, do you really think this is a big deal? And yes, it's a huge deal. It is essentially an existential threat. There's, this is a virus to which none of us have immunity. And it's a situation where there's a relatively high infectious rate. And it seems to like to be carried around even prior to having symptoms. You can be contagious. So it's kind of a setup for widespread infections, which is why it's a big deal. So yeah, it's a real thing. It's a big deal. We'll probably lose more people to this than we do the flu by the time it's all said and done. I mean, the director of the NIH over the weekend said he estimated 100 to 200,000 U.S. deaths, 1 to 2 million cases, which is well higher than the flu. So there's initial arguments of this is, it's not as bad as the flu. Not true. Let's see, Lacey, this is a good question. Because of COVID, what can we expect when we deliver in the next few months? What restrictions will there be? Great questions. The main one right now is that both hospitals, this is Ogden and McKay, so any Intermountain facility for that matter, and probably any HCA facility as well, one visitor the whole time. That's generally going to be your partner, and they will, I think at both hospitals now, they're putting a band on them, they're wristbanding them, and that's the one person. So there's no changing out to switch out for mom or your sister or whoever else. There's going to be one. So I think that's the main difference right now. I doubt very seriously we will get in Utah to lockdown where no visitors are allowed. That has happened in New York, although maybe that's going to get reversed because the state weighed in on it. But I think that's going to be the main thing. There's going to be a lot more questions about how have you been feeling, a lot more screening, have you had a fever? I'm hoping that in the not too distant future, what we're going to see is universal screening of all pregnant people who present to labor and delivery. There is rapid test now just got approved. Abbott Labs put out a press release that they got FDA approval over the weekend. You can get results in 5 minutes. So I'm hoping that we're going to see that as a point of care test at all labor and deliveries. We know that there have been 2 cases reported in the U.S. where mom presented no symptoms, 1 day later spiked a fever, and ultimately got diagnosed with coronavirus, and in the midst of it exposed like 50 people because they had no symptoms and no fever when they came in to be admitted. So hopefully we're going to see that universal rapid screening hopefully within the next month or so if we're lucky. And just expanded screening in general will help. So I think those are the things that you may see change. I'm very hopeful for the rapid test sooner rather than later. Let's see. Island Girl had a question on YouTube. Let's see. Is it a problem to be passing blood clots very often while on your period? Well, it just, of course, indicates that your periods are heavy. And so to have an evaluation for heavy periods would be probably the place to start. In the non-coronavirus world, then you'd have a physical exam, maybe a pap smear if you need it, an ultrasound. Things like that would rule out the majority of reasons why your periods might be heavy. Occasionally you'll find someone with a bleeding disorder that has heavy periods. That sometimes we think about checking. It's called von Willebrand's disease. But in this moment, if it was me and I had someone who was not currently trying to get pregnant, then we'd do something simple. Perhaps like birth control pills or something, just to kind of manage their heavy periods medically until things settle. All right. So let's see. Thanks. You're welcome to everybody saying thank you. Thank you. Thanks for jumping on. Thanks for putting up questions. Otherwise, I just sit here and say, anybody got any questions? So let's see if anybody's got any other questions. Otherwise, we'll wrap it up here in the next couple of minutes. I think I'm all caught up on both Facebook and YouTube. So thanks for joining on a Sunday. That's kind of a different day for me than my usual Fridays, but I don't know. Felt like doing one today. Okay, well, I'm not seeing any other questions pop up, so I think we'll wrap it up right there. Thanks to everybody who, here's one. Jennifer's got one. Can my spouse leave the hospital to help with kids and still come back, or do we need to plan on staying the whole time? Also, is the hospital stay being shortened? Okay, well, there's a couple questions there. The first one, can your spouse come and go? The short answer, I honestly don't know. I have not heard that specifically addressed. I would assume that it might be that they cannot, and play it safe. And that way you're prepared rather than getting surprised. So I think it's a good question. I've not heard it answered specifically, but I would assume that you might not be able to come and go. Second question is the hospital stay being shortened? Not necessarily. I would say that a normal early discharge is a very reasonable plan at this point. Now, this may change, right? Okay, so if things get really bad, then this may change. But for now, I think that you could say, hey, Bethany, how's it going? You could say, hey, Bethany, how's it going? I think for now you could say, for an uncomplicated vaginal delivery, 24 hours and go home. Very reasonable, assuming everything's going okay. Again, these are all low-risk situations. From a C-section, 2 days would be great. 2 days after delivery, 3 at the most, would be reasonable. Now, if it gets ugly, you may see times shortened where appropriate. So, say you have somebody who's had 4 kids and they're totally comfortable taking a newborn home, had 0 complications, didn't have hardly any bleeding and didn't need anything. I mean, you could probably go home at 6 or 8 hours and be fine. And it might come to that. I really hope it doesn't come to that here. And, at least so far in Utah, knock on wood, we haven't seen those kind of numbers in the hospital yet, but it's still early in the game. Our peak's not supposed to hit till about third week in April. So there's still time for this to get worse. And it probably will. It's just a question of how bad, and how full does the hospital get. The last model I saw from University of Washington's virology lab, which is well known, it's predicting April 24th or so for Utah's peak. They predicted that we would not run out of hospital beds, which is good. They did predict a shortage of ICU beds, but that's making a lot of assumptions, including things like, that there's no ability to up the number of patients you can care for in an ICU setting, which I know both hospitals, Ogden and McKay at least, have plans in place that they can up their ventilator capacity and without doing things like split and vents. So far we haven't gotten there. So that was a long answer, Jennifer. The short answer was question 1, I don't know. Question 2, not at this time. In summary, there you go. Okay, cool. We'll give another minute or so, see if anybody else pops on here. Social distancing definitely is a big deal. If you're just jumping on, wash your hands, stay home. If you can stay home, stay home. That is the gist of it. And if you're just jumping on, I've talked about it a couple times already, but we're offering virtual visits at the office. Some of those would be appropriate for pregnant patients as well. Some of those pregnant visits you have to do in person. I've talked about that a couple times now, but if you're just jumping on, friendly reminder. And for a lot of stuff, we can handle it virtually. So we have the capability for virtual visits now. So if you're interested in that, when you're calling in, mention that because it's pretty easy to set up. I think I did my first 2 on Thursday and they went fine. So it's basically like FaceTime, but we're using WebEx. So if you're a patient of our practice and you're trying to get a virtual visit, know that one of the things we're going to tell you is to download the WebEx app. It's WEBEX, WebEx. And then we send you an invitation to a meeting and a password so that only you can join the meeting and log in. So that's WebEx. So if you're interested in that, you can load it up and then we can get you an appointment. Okay, well, we'll give another minute. I'm not seeing any other questions popping on here. Good night, Island Girl, all the way in Italy. Stay safe. Stay safe. All right, guys. I'm not seeing any other questions popping on, so I think we'll call it good there. If you missed stuff, you can, once the video's over, it'll load to Facebook and it'll load to YouTube, and you can watch it back and see the answers to other questions that we had. So yeah, thanks to everybody who jumped on the stream. It's been fun. I'll promise not to wait 6 months to do the next one. All right. We're going to call it good. So thanks for watching. Thanks for watching Facebook and YouTube. We'll see you guys on the internet.